While you get that set up. And we are live for episode 2 of Just Massage Therapists, where myself and my partner, Coda, who are just massage therapists, talk about massage therapy things, healthcare things, our thoughts, and at the end of the day, we're just massage therapists.
We're just massage
therapists. So this is the first time Cora is joining for the podcast, and it's our second episode of the podcast, so that's quite perfect. And we are here to, just chat. We want to talk about our favorite textbooks and some of our not as favorite textbooks, maybe. Not that we're going to call anybody down or anything like that, but, some that we would use more than others, not just in our schooling days, but also now in our practicing days and our wonderful practicing days. So I guess, I don't know, do you want to get us started, Cora? Do you want me to get us started? That doesn't really matter to me.
That doesn't really.
No?
Doesn't matter to me either.
I think.
Well, actually, you know what? Yeah, I like to talk. So I'll start.
Oh, I love that. All right.
Let's put that out there.
Go for it.
All right. Well, my favorite textbook of all time actually is Trail Guide.
That's a good choice.
I love it. I love it so much. And the fact that we were able to partner with Books of Discovery just makes it that much more amazing.
Isn't that why you talked to them in the first place?
That is why I talked to him in the first place. But the fact that he said yes makes it like that much more. For sure it does. So this one is actually what edition? The 5th edition. I have about 5 of them.
Oof.
But this is actually one of my favorite editions because there is a trigger point manual built into it.
Oh, wow.
And then it has all the trigger favorite. There's other editions that have the muscles of the face, which are which are awesome. But this one's I love it.
Yeah, I do love that it's got the trigger points in there. Funnily enough, you have the 5th edition, and I managed to get myself a copy of the 6th edition.
Ooh, look at you go. Do we have the same book?
No, this is not my favorite, but it's in my top 5 for sure. For sure. When it comes to muscles, there is no better book than this, honestly. And you know what? I didn't check to see if this one had the trigger points. So you keep talking about like what you like best. I'm going to look for the trigger points.
Yeah, it doesn't have trigger points. You have the muscles of the face, though. If you go into the head and neck, you'll find the muscles of the facial expression, and it'll go through all their actions and pictures. And
okay, so that's the difference between. So 5th edition has the. Where the heck is the face? Oh,
it's the second chapter. Yep, the 3rd chapter.
Ooh.
Yeah. Super fun.
Cool.
And then the origins and insertions, the diagrams, they're so cut and dry. Oh, I shouldn't have turned off my backlight, but they're so cut and dry, and they don't use big words just because they can, which I really like too.
Yeah, I really appreciate that about them. Everybody at Books of Discovery, all their stuff is like that, which I really do love, especially being out of school now. So yours has the trigger point chart. This one, I think if you register your thing, you can access the trigger point chart, right?
You sure can. Yep. If you go onto the Books of Discovery website, you'll get a pin, and it'll be like, what is this word on this page on this paragraph? And then you'll find it, enter the word, and you get all the fun stuff, including the overlay images. I don't have a thing for Books of Discovery at all, though.
You don't have a thing for Books of Discovery at all.
No, not at all. But the thing is that's with all the textbooks, all of them have access to online learning.
Don't you dare talk about all of them, because my favorite one is one of them.
Okay.
My second favorite is, but no, keep talking about this guy. Does yours have the little sections with the muscles of like, how do you use them?
Yes. Yeah.
Yours does have that too. Oh, that's fantastic. So the only
Yeah.
thing that this one has that textbook, so this is the 6th edition. The only thing that textbook has that this one doesn't is the trigger points, right? In the 5th edition. And this one has the muscles of the face that one doesn't have.
Yeah. Well, actually, this one does too.
Oh, it does too. Okay, so why did they take the trigger points out? We may have to bother them, or are they putting into a new textbook? Or do you think we can speculate? Right?
Well, there used to be a trigger point manual that you could buy separately.
Oh, I haven't seen that on the website.
So a thing or not? I didn't see it. I found it by accident, actually, like a couple years back. I found it by accident.
I want to show you one of my favorite pictures from this textbook that we both love so much. Look at this.
Oh, cross sections. Yes.
Oh, when I was in school, I don't know about you, I hated cross sections. I couldn't understand them for so long. It took me a while after getting out of school and actually teaching stuff and really having to sit down with cross sections to start understanding them. And now I can't imagine teaching anything without the cross sections.
Yeah, I'm actually pretty similar to that. It wasn't so much of understanding them. It's just like, what's the deal? And it wasn't actually like, what's the deal? We have the muscles, right? But it wasn't actually until I started thinking about the actual layers of the muscles and how they relate to treatment and dysfunction that actually really made me be like, oh yeah, these are pretty awesome diagrams.
Agreed. And we learn that when we're in school, but there's so much that we're learning that a lot of the time that just kind of flies by and we don't get a true appreciation for it. I don't think until we really get started treating and we start to really understand those layers on a number of different bodies. The other reason I like these ones, they give you where the location actually is. You don't get that in many textbooks. You don't get the little picture of where on the body it is. Oh, we learn from, what's that textbook? The Tortora textbook called?
Anatomy and Physiology.
Yeah, the Principles of Anatomy and Physiology. Great resource. I like the resource. But sometimes you just didn't understand where you were in the body with the pictures. Especially if you were doing internal anatomy or that stuff is always so difficult.
Yeah, I feel that. It is. But lots of textbooks can be wordy though. And that's another reason why I really do enjoy like Books of Discovery, Trail Guide. Yeah. Because there's to the point and there's not a lot of talking just because they can, like some other resources.
Some other resources that we've used in our lives. Now,
one that we have to use still. This is not another one.
If anybody watching knows or has watched or not watched, oh my gosh, sorry. If anybody watching is a massage therapist, student massage therapy, you know that there is a textbook that we all basically use. At least in Canada, I don't know about the States, but in Canada, we all use it. And it's good, but it could be a lot better. It could be updated a little bit. Which is why we wanted to come in and talk a little bit about more updated textbooks that we're more confident in now as practicing massage therapists. So no longer focused so much on the basics and definitely more focused on advancing our careers.
I'm just going to turn this light back on.
Oh, yeah. Go right ahead. Who's watching stuff in the background? I can hear is that Jacob?
Yeah, he's getting his YouTube time in.
Oh, YouTube time. I love it.
Yeah.
Hey, you're getting your YouTube time in too.
So, literally, actually. when he found out that we were doing a channel, he was a lot butthurt because he wants a channel too.
So he's not old enough for a channel yet. He'll get there.
Yeah, the Green Bible, Delia. Yes.
The Green Bible.
Exactly right. The Green Bible. Where orbicularis oculi is known as orbicularis oris.
Oh, yeah.
Yeah.
But we're not here to call anybody down. We're just here to, mention that there are
Yeah.
better resources that are more akin to the advancement of your career as a massage therapist. Are we good on that one? Is there anything else you want to say about Trail Guide?
No, it's just awesome.
Yeah.
There's nothing bad I can really say about it. I guess the only thing I would like to see maybe is having the tarsal bones that tibialis posterior actually attaches to, instead of saying the 5.
Oh, yeah, because it's a little bit more specific than that. I think in that one, if I were to update or change anything, it would be to add more about the ligaments themselves, because I love ligaments. One of the things I'm going to be creating once I'm finished with this video I'm putting together is the ligament treatments, how to actually properly treat ligaments. But that's not why we're here today.
Well, actually, speaking of that, though, I actually did put in a request to Books of Discovery to add ligaments in to Trail Guide and to put overlay images of the ligaments out there, just like they have of the muscles. So,
my God,
they took me seriously. So we'll see what happens.
Yeah, well, we are very much grateful to them for letting us use their material. And in that vein, because we're starting with Books of Discovery stuff, Massage Therapist Guide to Pathology. This is my heart and soul. Look at this thing. It is coming apart because I have used this so much. It is it is very well full of all of my notes and my extra stuff, and this textbook literally has my heart. I love learning about the conditions that as massage therapists we might not see as often, or we might not be able to do as much with, if you would. All right, so yes, there's whiplash in here. There's the tendinitises. There's a bunch of stuff. There's constipation. There's everything that you could want to treat as a massage therapist in the world. But then there's things like leukemia. There's things like osteopenia and osteoporosis, which are things we can't really treat as massage therapists, but we have to understand nonetheless. And I find that this resource is very well researched. They do a lot of research. Let me show you. Where is the research page? Hold on, give me a second. Oh. Sorry, I'm just scrolling, because apparently I've been on my stuff too much, my digital apps too much. I'm turning pages, not scrolling. But this is just the end of one chapter for the research that they do. That's just one chapter's research. And not even one of the biggest chapters. That's a pretty small chapter. That's just the chapter on cancer. No, sorry, that's the reproductive system chapter. That's just the chapter on the reproductive system. So these guys stay extremely up to date. And they come out with a new edition probably every 2-3 years, and it's constantly updating itself. So I feel really confident with this one, and every research that I've done to double check whether or not it is real, it's always come up positive. Oh, yeah. What do you think?
That's a win.
What do you think, Cora?
I do actually really enjoy that textbook also. It's one that I do still reference actually quite often in my practice. I have it in my massage bag with my trail guide.
With your trail guide. Yeah, you can tell what we really went after being able to work with these people, and they have been so generous to us. And honestly, it's because we love their books. We've always loved their books. I can remember times when we were working together in a scholastic environment where we would just sit down and talk about Trail Guide. I would, however, say that the only thing that this is missing is how to use massage to the greatest benefit for each of these conditions. Right, so this goes through the conditions, it goes through the cautions, the risks, the benefits, all of that stuff. So it's got everything you really need, except for this would be a good direction to treat, and this is how to create a treatment plan. It's the only thing that this textbook doesn't really do for us. It's the only thing I think that's lacking, actually, in books of discovery textbooks, right? And it's something that it'd be really interesting to see if that could be added, or like a new textbook created, something like that. That would sort of be a complementary book to this and to Trail Guide, because those three together would be amazing. Yeah. All right, so those are our first ones. Do you have another one?
I do. This one is, my next one is actually Joint Play the Right Way for the Axial Skeleton. This isn't one that I really used in my treatment or in my education per se. It's not one that was really brought out. But as a therapist, I really enjoyed the appendicular skeleton. So I went into the axial. What I like about this textbook is it kind of branches off from joint play and it moves more into muscle energy techniques. So there's a lot of muscle energy techniques in here where we're able to incorporate muscle contraction in order to mobilize the joint.
Oh,
so they're doing the work for us.
That's pretty cool.
Yeah, even for the cervical spine, like it's really amazing. I really like it. And then there are a lot of, general mobilizations that we would use in treating things like COPD, hyperkyphosis. So those are things that we see all the time. Whiplash, like there's mobilizations in here that are very beneficial for whiplash. There's PNF in here.
There's, I love some PNF.
You name it, and it's here.
It's my favorite kind of stretching.
It's so nice.
Oh my gosh.
I actually didn't start appreciating it until about like 3 years ago.
Oh, wow.
And that's actually when I was like, oh, okay, maybe this is something. But I never actually really appreciated it until, like I said, about 3 or 4 years ago when I actually started to delve into it, because it wasn't really something that was really a focus on my education. My education was more focused on, because even joint play, joint play was like a 2-week
thing
course, maybe 3 weeks. It was so small and it was rushed because we were running out of time. So I didn't even really have an appreciation for joint play until I getting into my practice and realizing there's got to be better ways than just mobilizing the muscle. Like there's more to it than this. So
that is so cool. I didn't get to do joint play the right way either one when I was in school. We did do joint mobilizations, but they were, again, it was pretty small. It wasn't until later on in my career, a few years after I graduated school, that I actually started learning about joint mobilizations and what they could do. So yeah, our story's very similar. I love that. Granted, I started falling in love with it early on. Oh, so early on. I'm talking like 15, 14 years ago.
It took me a bit to... Yeah. Okay, yeah. See, I was very fascial. And then, so I was very much in the fascial system, mobilizing, like getting, treating those fascial restrictions, and those muscle energy techniques that I did know I would utilize all the time. But I really only knew them for the pubic symphysis and the SI joint. So it was only really 2 muscle energy techniques that I was educated in, that I knew existed. And I was always wanting to learn more. And then once I found this textbook, I was like, oh,
here they are. That is really cool.
So
yeah, I love all of the like pin and stretch or mobilization type treatments like MET or strain counter strain. Those are all they're amazing. They're pretty fantastic. I don't like when it comes to the joint mobilization, so I don't like teaching it. No, I don't like going through it, because I feel like if you know how the joint moves, you should just know how to do the mobilization. Like if you know, it's one of those. I get really impatient with that kind of stuff. So I'm not a good teacher of that. So if we ever do that, we're going to either have to have you do it, or we're going to have to call Mike Dixon in to do it, because
he did offer.
So we might be able to get some joint play directly there in Saskatoon or possibly other areas around. Oh, that's exciting. Well, there you go. For those of you who watch this, you got a
Yeah.
little insider information there, which I didn't even know. Oh, that's awesome.
Sorry, I thought I
you know
told
what?
you.
You might have. Honestly,
Okay.
you might have told me. Sometimes I don't remember what you say. I don't remember what anybody says.
That's fair.
My memory is very one track.
It goes both ways. I thought today started at 5.
Point
so.
taken. Point taken. Yeah, yeah. No, my 5, your 7. That is so funny. So there are 2 major textbooks with him, right?
Mm-hmm. Yeah, the 2 that I'm aware of anyways. There's a Joint Play the Right Way for the appendicular, and then Joint Play the Right Way for the axial.
Okay. Well, that's pretty cool. I've looked at them. I've definitely looked into them and stuff, although I have a whole nother textbook that I use for joint mobilizations, and it's so funny because it is my next favorite textbook. It's my number 2. That is so funny to me. So if you are done, I will bring this guy out.
Okay.
Okay.
Well, actually, first, I just want to draw attention to some of the pictures.
Yeah, please go
with
for
the
it.
joint mobilizations. Like this one's for the scapulothoracic joint, and I just love how he shows the hand placement and the directional, and he incorporates the directional
able to bring
arrows.
it a little closer because it's a little fuzzy.
There we go.
Yeah, okay, right there.
So it shows that translation direction. So how you're actually mobilizing the joint, what our goal is. And then as we come up, it actually tells you the purpose of the mobilization. In some of them, it also talks about the type of joint we're dealing with and the movements available at that joint.
Cool.
So, and then it also has little it has precautions in there. So CIs, when you would not use this, and also modifications for ergonomics.
Oh, yes. Yeah, that makes sense. Well, the modifications would be really fantastic, especially if you have someone who can't sit a certain way or stand a certain way, right? Somebody who has really crazy scoliosis, you're going to have to position them very differently.
Right. And even you, depending on what's going on with you, it tells you you could stand on the opposite side, and this is how you would do it this way if you're working cross body, which I'm not a big cross body.
I'm such a cross body person.
But
all right, that's pretty cool.
I tend to lock my knees when I go cross.
Oh no, don't do that. No locking the knees. We all know, right? No locking the knees. Everybody, shame on Cora. No, I'm just kidding.
Well, I'm aware of it.
I'm kidding on the shame thing. We all have things that we do, right? We really all do. I have a habit of not having a good angle at my wrist. Right? I will overstrain my wrist a little bit, which for a massage therapist is bad. One of the reasons why I've stopped using my fingers and thumb as often, because I got into that habit, and it's really hard getting out of that habit.
Yeah. See, I can't use my fingers for different reasons. They just lock.
Oh, right. Yeah.
All the time. All the time.
Yeah. Are you a knuckle or are you an elbow?
Forearm.
Oh, so the whole. Nice.
Yeah.
That's pretty cool. I'm a knuckle. I use my knuckles for almost everything.
Okay. I like the knuckles for the neck. I use the knuckles for the neck all the time.
Oh, yeah. The first time I ever used knuckles for... The dog just crashed into me. The first time I ever...
It was a cat.
The first time I ever used my knuckles on somebody's neck, I was in school. I was so nervous, right? Because I'm like, I don't know if I can feel it properly. And I was so nervous I was going to just rake right across their spinous processes. I was just going to go, oh my gosh. It freaked me out. But, with time and practice and stuff, I got really good at pulling.
Oh, yeah.
Pulling and pulling. And then if I would go down, I got really good at being able to feel where the spinous processes were as I went down and around. Oh, yeah.
Amazing.
And I can't do it any other way now. I mean, if I have to, I can, but... Do you do the...
You'd rather not.
Go under them and then come up and pull back underneath their shoulder blades, like just inside their shoulder blades?
I'll like in the upper thoracic, and I'll just knead up around the scapula, and then come up around the traps, and then follow that way.
Yeah, when they're supine, just coming up, and oh god, that feels good.
Yeah,
it's like the best kind of hurt.
Oh yeah, it is. Yeah, like it's so nice. And then afterwards, like, oh, I just got a whole bunch of adjustments. Like, that's good.
Basically, yeah, the whole area just realigns itself a lot of the time, not all the time. So
it feels good either way.
My second favorite therapeutic exercise for musculoskeletal injuries. This is a massive textbook. It's got so much information into it, and honestly, it's taking me years. I mean, I've known about this, and I've been reading this textbook for, I don't know, probably 7, maybe longer, but about, I think, roughly around 7 years, and I still haven't explored this whole thing. This thing gives me just so much. It's kind of like, hey, if you are going to be going into physiotherapy or physical therapist assistant, or if you are going to be working as a massage therapist, like it goes and it works for all. It's not specific. When I was in school, the textbook we used was specific for physical therapist assistants. And I mean, it was good. Don't get me wrong. It was a good textbook. It was, therapeutic exercise for physiotherapist assistants. But it just was a little too wordy for what we needed as massage therapists. And even this one, it gets a little wordy, and you got to really have an open mind about looking up definitions as you're going through. So if you're really thirsty for knowledge, this one just has so much in it. This one is also where we get our a lot of our timelines for healing. Right, so the acute phase, the inflammation phase, I should say, the proliferative phase, and then the actual healing stuff. So yeah, I don't know. I really love this textbook. It's got so much all over it, and there are mobilizations, stretching, and strengthening exercises inside of this, as well as going well further past that into more functional exercises, which is kind of fun. Kind of exciting. There's some taping in here too, and I did take a taping course way back in the day, but I haven't kept up on it. But there are some like actual taping presentations in this textbook, which I love. So yeah, I don't know. It's a lot. In here, it goes through some of the conditions that we look at and see as well. So this one's adhesive capsulitis. Then it goes through the stages of each of them. So it goes through the freezing, frozen, thawing stages. And then it talks about how you can use exercise towards it. So it doesn't really have the massage side of it again, but it really focuses on how to work with somebody and giving them a lot of home care or things that they can do with you that's exercise focused, that will do a really good job of coupling with massage or coupling with other manual therapies. I wouldn't say that physiotherapists and physiotherapy assistants, they can do so much with just the stretching and strengthening, but they also employ massage techniques like we do as massage therapists. So there's a lot of crossover between the two, and all of those things working together is actually more beneficial than any one of those things working apart. Just like our whole body has multiple systems that work together to keep us balanced and living, multiple different modalities of healthcare working together helps to make an individual function better. I think that's why I like this textbook, because it does not focus on any one profession. It focuses on the client, the patient, what their needs are, and not looking at it from any one particular lens. It combines the lenses. So yeah. Go ahead.
That is a good textbook. Honestly, I can't get past the pictures and the plaid pants.
Okay, plaid pants aside. I got it.
The information is good.
Plaid
But I look at those pictures and I'm like, oh.
You are hilarious. How dare you? How dare you?
Like, nothing against plaid pants.
Yeah.
But like all the pictures, like
there's nothing wrong with the plaid pants.
No, there's not.
Welcome in, Randy. Sorry we didn't see your message until now. Yeah, we were talking about textbooks that could be better used if they were more updated at the moment that we talked about the Green Bible. One more interesting thing to note about this textbook is that there are videos that demo, right? And it's a resource that is sorely underused, honestly. The resources of videos demoing how to do things properly, and there are quite a few of them in here all throughout this textbook. And I forgot to mention that with the Massage Therapist Guide to Pathology as well. There's a ton of wonderful, interesting little videos. They're not so much demoing as they are just the author's thoughts about them, but they're quite fun to listen to. Ruth Werner is a very smart woman. They are. Very, very smart woman. And I hope one day to actually get an opportunity to, talk to her at some point. Whether it's just me sending her stuff and she reads it and just goes, oh, that's cool. One day, maybe. It's a hope.
Collaboration.
I love collaboration. So yeah, those are those. There's a couple of other textbooks I find are really interesting, but again, could be a little bit more. There's a whole variety of textbooks that come out of ProHealth Sys, which I really love. I love my membership with them. I love doing stuff with the courses that they have, and they have all of Grey's Anatomy. We'll talk about Grey's Anatomy after. And I love it. I just sometimes find that their textbooks are more on the go textbooks. They're not so full as some of the other ones that we've looked at. And nothing wrong with that. We need some good on-the-go things. I've got a few like flipping flashcard type books that I bring with me when I really need them. Right? I have one with trigger points in it, and I just flip through and find the trigger point. So they're really good for that.
Like
they're really good, I find, for that. For the just, I need to quick reference this in the moment. I love them for that. So yeah, they're great for in the moment, but for really studying and growing and learning more, I would turn to other resources. Unfortunately, there aren't a lot of other resources when it comes to massage itself. So many resources for the other things, but when it comes to massage, there's so many that are just splayed all over the place, and there's contradicting evidence in both of them, and it can be a little tricky. So it'd be really nice to see eventually something come out that can rival the Big Green Bible. Something that can go, all of that is really good, but this is more up to date. That'd be a really nice thing to see eventually.
And it will happen.
I really hope so. I know that there's a lot of people who talk about it and think about it. So I hope that it does happen. Instead of having like the multitude of Chatow books out there, if you haven't heard of Chatow, Dr. Chatow, he's freaking awesome. But he's got so many little books about one technique and how you can use it on here. There are so many papers and so many research articles about different conditions and how massage can help those conditions. And they're amazing, but they're not being utilized to the best of their ability in a scholastic type of setting or an educational type of setting. That's my 2 cents.
Yeah. I agree in that.
Yeah. Don't even get me started on Grey's Anatomy. I love the old Grey's Anatomy. I use the pictures all the time. And because it's in the public domain, you can go and use Grey's Anatomy. We actually just put up a whole bunch more pictures on the website from Grey's Anatomy. All the muscles are now on our website, where you can go and just download the pictures if you want them. The information is worded as it would be worded in the early 1900s. So it's hard to understand it unless you have spent a lot of time in there, which is one of the things that a lot of these places are trying to do is update that information. Anatomy doesn't change a lot until we discover something new.
Or they decide to just rename something, make a tubercle a trochlea that's not even spool shaped.
we're not going to talk about
It's a
the
thing.
peroneal trochlea. Oh, I liked it as
It's a
peroneal
thing.
tubercle and not the trochlea of
Me
the
too.
calcaneus because it's not spindle.
It's not a trochlea, but
Yep.
the anatomist
But
says
you know what they did do recently, and by recently I mean maybe the past 5 years. And if for those of you who don't know, recently and 5 years, that's about right for textbooks. Textbooks are almost about 5 years, sometimes 6 years behind where we're at in research. Right? Now, that's not always true.
Well, it's just
not always true. But yeah, there's just so much research out there. But the suprarenal glands, I'm actually coming around to, I hated it at first, but I'm coming around to calling the adrenal glands the suprarenal glands because it actually makes more sense on top of the kidneys.
It does, yeah.
Whereas adrenal glands above, right? They both work. They do. But if they're going to really push going towards suprarenal gland, they really need to start changing the names of things, like the HPA axis. It has to be the HPS axis now, right? Because hypothalamus, pituitary, adrenal. If they're going to push suprarenal, they need to change it from hypothalamus to hypothalamus, pituitary, suprarenal. And that's going to screw a bunch of textbooks up.
So much work to change names. They should just focus on learning more about the fascial system and the lymphatic system so that they can actually understand these conditions that are idiopathic, but actually are not. We just don't understand the system.
Throwing shade. I just saw some shade being thrown. I love it. Don't hate us for throwing some shade. We're going to throw shade here and there because, yeah, a lot of things we believe, I should say, individually, that a lot of things that are idiopathic could be better explained if we understood certain systems better. Right? We're always learning. There's always more to learn about the physiology of our bodies. I mean, they're not even close. They're not even 1% understanding the human brain. And I say 1% because honestly, they've been trying so hard and they keep learning new things. They've only got a few things down pat, and a lot of what they got down pat about nerves come from giant squids.
I just think that's so funny because the brain knows everything that's happening. Like, why can't it just tell us?
Because it doesn't have the words to tell us. It does not. We have to create the words, and the only way to create those words is to research.
It's to discover.
Research. Speaking of research, the other thing I would love for anybody who watches this ever to think about is PubMed. Right? Now, one of the beautiful things is you can go onto PubMed and you can look up very specific topics. You can look up massage and this, or you can look up a type of condition or illness or disease process or whatever it is that you want to look up. You can look it up on there, and there will be plenty of articles. Now, for the most part, you're going to have to pay for a lot of those articles, so there will be some free ones. And if you want to, you can look through the articles. If you see some that you really want to read but you don't really want to pay for, find the authors. Get a hold of the authors of those articles. A lot of time the authors will just be like, I would love for you to read this because that's why I wrote it. I wrote it to be read. Some of them will just give it to you. Some of them will ask for a fee, but that fee is then going directly to the authors, to the researchers, and not to the government that runs PubMed. Not that that's wrong, not that that's bad. It's really nice that they've come together to have all this available to people who are interested. But a lot of the time you can just go directly to the authors, the researchers themselves. Yeah, so that's my 2 cents. Hope it doesn't get me into too much trouble. Okay, well, I I've got nothing else really that I've got to bring up. I really appreciate everybody who's come in. Cora, do you have anything else you want to talk about today?
Well, Grey's Anatomy kind of just triggered netters for me. Your Grey's Anatomy to you is netters to me. As far as origins and insertions go, there's not a lot in that textbook, but the images are amazing. I don't have my copy here, and the cover is sparkly, and I like sparkles.
Yep. There's nothing wrong with liking sparkles.
But the images are amazing there too, and just the not even the cross sections, but the hooks pulling the structures apart so you can see the depth. It's nice too, and they're really cut and dry, very sharp.
Yeah,
color.
that is true. That is true. I really like their pictures of ligaments. Honestly, they're
Oh yeah.
If you want to give Books of Discovery a source to get inspiration from, that is a source to get inspiration from, because their ligaments are so good and so clear. Yeah, I love that.
They're so nice. And the psoas is just such a beautiful picture too. Like abdominal cavity is just like, oh, I could frame that and put that on my wall.
It's like they scooped everything out and just and there it is.
There it is.
That is
and it's so
not
pretty.
a visual I
so
really
beautiful.
wanted to think of, scooping out the whole abdominal wall and just pulling it out.
Oh, I was just thinking of the psoas.
Oh, that's pretty good.
I was like, yeah, there's a psoas. And I just got the image in my brain. I'm like, yes, what a beautiful muscle.
I love it. All right. Well, I think that's probably as good a place as any. I can't talk. To end podcast today. Thank you so much for joining us and taking a brain break with us, if that's what you were doing, or just coming to hang out. And for those of you who watch this after the fact, don't mind the little bit of noise in the background. We at CNC, we believe that our family matters more than anything we could ever do. So if we've got a little noise from our families in the background, it doesn't matter to us. We're quite happy to be able to share our time, even if it's in the same room as our family with you. So yeah.
Truth.
Yeah. Any last words, Cora?
Just be healthy. Make sure you stretch.
Be healthy. Make sure you stretch. Hydrate. Please hydrate. Oh, I'm so glad you liked it.
Oh, hydrate. Yeah.
So yeah, Cora's going to be joining me every third week right now, for the podcasts, and then all the other Thursdays it'll just be me bringing up just some thoughts from a massage therapist's perspective, and then eventually we'll have other guests and whatnot, but this is where we're at now. So
yeah, and I might be a bit more frequent than
we'll see how you feel and what time you have. You are the one that is most strapped for time, so yeah. All right. Well, thank you so much for joining us. We are going to sign off for Just Massage Therapists.
Oh, yes. And rest.
Oh, yes.
Can't forget the rest.
So have a great evening, and thank you so much. Oh, I got to actually press the goodbye button.